I'm Rick Buck and I've been a dentist for 15 years. You're about to see how and why I fix these white spots on front teeth, including all the steps I take and why each step is important. All along the way, I explain what these spots are and why I do this method as opposed to other methods of getting rid of white spots. So subscribe to my channel if you have teeth. If you watched this patient's last appointment, we removed only the decay from these front teeth. This is what those teeth looked like before that appointment and then after that appointment. And so once he saw how much better those were, he immediately scheduled another appointment to get rid of the white spots. Now, what is interesting about that is those white spots were way more prominent at the end of that appointment than they are here today. The reason is the more dehydrated your teeth are, the wider these spots get. And we were constantly removing the saliva from his mouth, and even unnoticeable spots are noticeable by the end of the appointment. And that is going to be very important today because the same thing is going to happen. So we start by removing the noticeable white spots with this diamond burr on a high-speed drill. But I'm not going to remove the white spots that will be noticeable when the tooth is dehydrated. I'm only going to remove the spots that are noticeable when the tooth is hydrated. Now, the reason I'm not going to remove the spots that show up only when dehydrated is because it's best not to remove anything we don't have to. We want to keep this tooth as strong as possible and not unnecessarily weaken the tooth. So now you may be wondering what these spots are. Generally, white spots are from dysfunction in the mineralization or calcification process of your tooth. For example, if you had too much fluoride, got sick, or took medication while your teeth were developing, it could have these spots integrated into the tooth. Another possibility is that the beginning process of tooth decay decalcifies your tooth. And if it hasn't gone too far, then your body can still remineralize that decaying process and it will leave one of these white spots. So the white spot could actually be once decalcified and remineralized tooth. And so let's just say that there's a teenager that had poor hygiene when he was in braces, has his braces removed, and once good hygiene is resumed after the braces are off, those spots become remineralized. And these remineralized spots are a good solid tooth. They're no longer cavities. And once the tooth becomes solid again, those white spots remain and the tooth becomes solid. Okay, so as I drill the white spot away, I make sure there is no white border left even on the edges where I am removing the white spot. Once the white spot is removed, it is time to fill the teeth back up again. We start by etching the surface of where we drilled. We call the slot where we drilled the prep or the filling preparation. This blue etch that we're using is 35% phosphoric acid and will enhance the bond that we will make of the filling in just a moment. Now, once we use this etch, it will really start to dry the tooth when we wash it away. So more white spots are really going to start showing up after this. In fact, I added a thin layer here in one spot without a noticeable white spot to show you the effect. Next, we use a bond called Peak Universal Bond. I have personally tested out this bond against other bonds and found it to be the strongest. It also helps the bond strength if you scrub the bond into place. Scrubbing the bond into place once again gets a better seal than just flowing the bond on top of the tooth. Once we do that, we suction off with air the excess bond, and then we use this intense light which cures or sets the bond. If you look closely after I cure the tooth, there are more spots that are quickly starting to show up due to the chemical reaction from the light and all the bond and etch and everything that we've used. Now that we have the bond set, we are ready to express resin composite filling material into the prep and then start to shape it. As I shape it, I'm also checking to make sure the filling color matches. If it didn't, I would quickly remove it and then I place another shade of resin filling material. So as I'm shaping this, I use my instrument and also I use my glove finger to tamp down the filling. The combination of the glove and this instrument gives it a more natural look. And once I'm happy with the way it kind of looks, I set the filling material with the light. I will do more refining of the filling in just a minute. We're getting close to the end now, so we smooth these fillings with this refining drill bit. We are making everything flush and smooth to prevent future staining around the edges of these fillings. You see, when we put this filling on top of the tooth, sometimes we get this exceedingly thin layer of filling called flash, and it's very hard to see and it needs to be removed. If it's not removed, it will easily catch staining underneath it and even tooth decay. Now, luckily, if it catches staining and the dentist doesn't see it, sometimes years down the road, you can still just do this same step and buff all of that staining out. But here today, to make it look really nice, I also, after this, use this series of discs to refine and polish the filling so it looks smooth and shiny and beautiful. Now, this is what it looks like at the end of the appointment compared to what it looked like before the appointment. Now, can you see some of the white spots? In less than an hour, once the tooth is hydrated, these spots are going to disappear again. The reason why I didn't remove them is most are near the biting edge of the tooth. You don't want to remove those near the edge because the closer things are to the edge, the more likely the tooth can become susceptible to chipping and fracture down the road. Luckily, this is what the tooth looks like in a few days, and actually it is what it would have looked like a few hours after the fillings if I was able to take a picture then. Now, not all of you, but a lot of you arrived at this point because of a lack of adequate hygiene, and you may have even thought you were doing a good job. Watch my daily dental care video I have posted now for the best technique, tips, and product recommendations for a stunningly clean mouth that avoids tooth decay, gum disease, and gives you fresh breath. The best dental products that I recommend are in Amazon affiliate links in the description below. If in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.